Hello, everyone. Thank you for being a part of our Senior Dog Care Summit 2.0 Day 2. Hopefully, you've been able to partake of all the different programs. I've enjoyed hearing our presenters and everyone that added to that today. The topic was preventing injury and reducing pain. And we started off with Sharon from the Vision Light giving a program on photonic healing and LED light therapy. And I want to thank her as a sponsor and also thank Chi Dog, who is our other sponsor for this summit. Really appreciate their helping us along and making sure that these programs can continue and that everyone can get the benefits of helping their animals through this holistic way. Then we had Dr. Edward was talking about silent pain, Amy Hayek, Dr. Hayek about chiropractic care. Dr. Don Gleason shared some really wonderful insights about how to improve your home environment, just little simple things that you can do so that those senior dogs can navigate a whole lot easier throughout the house. Wendy Corin gave a program on cold laser for the seniors, and then Bill Armston talking about toenails and how important it is to keep those trimmed up. So it was a really fun day. And I'm sure you guys have some questions about some of those topics and things that happened with your, maybe specifically about some of your pets. So we're going to open it up to conversation. Also, just want to give you a heads up that for those who are enjoying this and want to take a bigger jump into some of these topics, we do have the post-summit program where all the programs are presented by myself. We've got the 4 pathways of pain so you can understand a little bit better how you can address pain at all different levels, talking about Lyme disease, chronic inflammatory conditions. There's a program about cancer, harness fitting. There's the dog problems. Oh, actually, the harness fitting is going to be tomorrow on here. So cat arthritis, we've got just a lot of extra specials on the program that we haven't had before. So we're looking forward to seeing some of you. And then at the end of next month will be when we actually then get together and discuss those courses that you did and any questions you have about that. So that'll be a whole lot of fun. Just giving a little bit heads up for that Life Extend Method program. Okay, so we'll get in on our questions here. So make sure we can address anything that you're concerned about. Also, just another little heads up, we did have some video problems yesterday, and I'll just do what I did. If it ends up that I freeze, I'll back out and come back in and try to remember where I left off. So don't get worried, just stay there and I'll be able to come back in and continue the program, finish answering whatever question I was working on. So let's see here. While we're waiting for somebody to come up with one of their questions, let's see, where can we go? I think the topic of silent pain was probably pretty interesting for you. Dr. Edward has definitely launched his site and has been doing a lot of these type of programs, so you may have heard him. He was also on TED Talk, which that's pretty cool. I always thought that would be fun. So he actually made it to the stage one time and did some of his presentation there. But he's helping you to understand that a lot of times that pain's not obvious, or the individual may be quite stoic and doesn't express the pain like another one might. So you have to look for those little subtleties and actually learning to see with your fingertips, becoming very cognizant of what's normal in your particular dog's body, what feels right, or if there's a firm area, what feels different than before. And also just how they respond to your petting or your handling. Are they comfortable and want you to touch them, or is there a part of the body that they move away from when you get there? Are they good with doing stairs like they've always been? They still good with that? Or do they hesitate when they go to jump up on something and think about, oh, how am I going to do this? Because those would all be some of those indicators that there is some kind of silent pain there, where it's not so obvious, but it's still going on. So different ways through his massage techniques and his touching, assisting, things like that, that you can actually address that and help that to go away. And a lot of what he does too is helping to move the lymphatics. And when that circulatory part of the system is working better, then you don't have the buildup of the toxins and the fluids moving out. And so circulation is much better. All righty. All righty, I'm back. Sorry about that. All right, so we have our first question. Welcome. Glad to see you here. Says, my dog gets very soft stools when he eats raw dog food. What can you do about that? Also, can I cook raw food with bone dust? I can buy some with meat, organs, and bone dust, but I am concerned about cooking it. So that's fine. You can like lightly or gently cook, especially for some of the older ones. It's even easier for them to digest because it doesn't require their furnace to have to heat the food up before the body can assimilate it. So that's one thing. As far as the soft stools, I mean, the raw certainly does have a higher moisture content, but the body should be able to work through that. So things that you could add if you wanted to add a little bit of oatmeal, so get some organic oatmeal. You can cook it a little bit, but don't cook it all the way. The oatmeal is a very good adsorbent. So you could even just take the oatmeal and mix it in with the food like it is. So it would be one way to help. Platinum Performance also has a product called BioSponge, which is bentonite clay, but then they have a proprietary ingredient in there, and that helps to solidify the gut there, so it'll help with the bowels. I mean, it might be that there's a little bit of a gallbladder situation going on. The gallbladder is about producing the factors that help to firm up the bowel, the feces. So there may be something there, and that may be why the reason. So it's not, and then on your other part of the question, if you have the raw with the bone dust and you heated it up, that's still okay because it's not like you're going to go through a big process where it denatures everything. You're just looking about gently cooking it. So you certainly can do that. Alrighty. Next question. I have a question. My dog has arthritis. She's 14, Australian cattle dog, and I have her on meloxicam, but it's been raising her liver count. Is there something better I can do? Yeah. Okay, good. So any of those NSAIDs can affect the liver. The meloxicam also has been shown to interfere with kidney function as well. So other things that you can do, product-wise, would be Boswellia is a COX-1 and a COX-2 inhibitor without affecting the liver or the kidney. Boswellia is frankincense. So you can find it in powder form. You can find it in tablet form. MediHerb Standard Process has Boswellia complex, which also has ginger, celery seed, and turmeric in it. So it can be really good, but you can get Boswellia just as a powder by itself as well. So that's really good. Those are two of the ones that I go to first, MSM and the Boswellia, to see. Cordalis is a plant derivative. It's where the gabapentin was taken from as a chemical. So you can use that a lot of times too. I'll tend to give that at nighttime when they're going to be sleeping anyway, rather than giving it to them in the day and maybe use one of the others today. But those would all be situations where that you would have options as opposed to the meloxicam. And there may be some that it might also help you to lower the meloxicam dose by using those others. So you can add those in conjunction with a meloxicam, reduce the dose, add those others on, and then see how she does. All right. Thank you, Rachel. Rachel says she's excited. You're wondering, how do I go about rotating proteins and what proteins do I rotate? All right. So leave the question up there, Gindy, so I can just address the first part and then I'll go to the next part. So you give a lot of options on rotating proteins. You can do it daily. You could do it every other day. You could do feed one for several days and then the other. Some people will do 1 week of one week of another, rotate that way, alternating weeks. So there's a lot of different ways that you can do the protein rotation. We usually look at the proteins and then organize them by the season too. So the hotter proteins like lamb and goat and venison, you would save those for the winter time. The cooler proteins, duck, some of the fishes, rabbit's a little more on the cooler side. Pork is cooler neutral. Those in the warmer summertime, and then use the chicken, turkey, beef in the spring and fall. Some of those medium type heat proteins. So that's another way to rotate the proteins. And that's the way I usually recommend doing it. You haven't started raw or gently cooked yet, but you want to make sure you adhere to each dog's needs while not depleting their diet or over providing nutrients and vitamins. Yeah, so they certainly will get a lot better quality nutrient and vitamins. They'll get the taurine out of the real meat, which isn't going to be there in the processed food unless it's added in by doing the raw or the gently cooked. Even the freeze dried is better than kibble. And then the canned food is a problem just because of all the additives that are in there, trying to avoid the carrageenan and the guar and things like that. So your dog will definitely be healthier just because you do the switch. If they're older, then again, like I just said, a lot of times to heat it up a little bit. That way they're not taken away from their body heat in order to warm the food up in the stomach. So that's helpful too. And then other ways to get proteins in them. Whey has all amino acids, eggs, and chia seeds. So you can use those as other alternatives to bring in proteins in. Legumes and beans are also, so navy beans, kidney beans, mung beans, lentils, those all have protein in them too. But then you get into some of the other considerations about using lentils. So if you really want to stick to the meats, then rotate seasonally. You can rotate throughout the month, and then probably doing a little bit of that gently cooked. Thank you. All right, Chelsea says, how can I help my 13-year-old Shih Tzu that has muscle atrophy in her hind legs? Okay, she has arthritis in her hips, and you don't have access to give her hydrotherapy. So she's a Shih Tzu. If you had a bathtub, they're even small enough. You can put the water in the bathtub and have a mat down and just help them walk around. I still like putting a life jacket on because it helps them be more buoyant and they're not themselves having to, work against the gravity even in the water. So a life jacket, but that size dog you can put in a bathtub if you have a bathtub and then walk them around that way. So you can still get the benefit from the warm water hydrotherapy, even if it's a bathtub. That I've seen some things you can put in the tub that helps the water circulate. So you're not having to flap it with your hand. So you can do that. Chiropractic certainly is number one to help the nerves throughout all of those joints and make sure that there's not also something up in that thoracolumbar area. A lot of times when their rear end gets weak, they start having that kyphotic arched back, and then that area will get kind of bunched up. So being able to relax that, doing massage. So that soft tissue work on that is also very beneficial along the back muscles, the leg muscles. So you can do that. Then for the arthritis itself, you're looking at certainly the glucosamine chondroitins to help get the viscosity of the joint fluid up and repair anything about the cartilage that's going on. Then using some of those alternative options that I've recommended for the inflammation and the pain. Even just doing, some dogs are going to like warm better. Some are going to like a cool compress, depending on the arthritis that's there. So find out what she likes best. Cool is going to take the inflammation down, but warm is going to help the circulation. So a lot of times I'll do warm compresses in the morning to get them going throughout the day, and then do the cooler compress at nighttime to help cut any inflammation that happened throughout the day. So those would be some tips for her. Yeah, you should be able to get her in your bathtub if you have one. Or even you can just buy a big tub someplace that you could have that you put the water in, like you would your bathtub, and then move her around in it. Very good. All right, Sharon is considering adopting a dog that was hit by a car. He has fractures in his hip and L5. Okay, 10 weeks ago. He was not given any surgery. He can walk. All right, so it's feasible then that while he had the fractures, there may not have been dislocations within the fractures, that there were broken lines there, but everything was still fairly well intact. So, all righty. So, what I was saying about that the fractures are probably not severe, so that may not, once they heal, cause any terrible arthritis or impairment. And so for right now, I mean, it would be good to know before I made any recommendations what radiographically was there. But if you maybe can find a rehab therapist, whether it's a veterinarian or a PT that's in your area, that you could have them help you with doing some exercises, get you started on the right thing. I definitely would consider a harness that you can use to help lift him and get him up. One of the most difficult is going to be him plant weight in the rear and then push in there to get himself up off the ground. So a harness that is like a body harness, roughwear.com, ruffwear.com. They have ones that support the tummy area. So when you that helps and use like a little handle like the navigate off learning that would be very beneficial. 10 weeks doesn't seem how old he is, but if he's young, then he's going to go quicker. If he's older, it's going to be a little bit longer. So then I also consider, because of the fact that most are calcium and magnesium deficient and zinc, I worry about getting some supplementation that's calcium, magnesium, zinc together to help him with the healing process because majority of deficient in those minerals. Alrighty, and then what should I be aware of for the future? So the future may not be problematic if the fractures are not so terribly displayed, where they're the arthritis. So it could potentially that arthritis could develop depending on how much he weighs, how that's all a factor. It's a dog, it's probably not in the end to be so bad. You can always pick them up and help. 70, 80 dog, that's going to be a little bit different situation. Also, hopefully, it's not that big of a dog. All righty, very good. Well, congratulations on finding a friend that goes. Yeah. Should they be yearly vaccinations? No. I always everybody to doctor's site, animal.com, and all of the whole hypervigilance of the practice. The only veterinarian who has seen in the practice is aware of the fact or want to acknowledge the fact that vaccines can cause problems. There has been more research of these different problems, and there's more talk within the veterinary industry. So not everybody is pushing it like they used to. I just had somebody though yesterday that she was like not going to get the vaccinations, but by the time she got out of the veterinary clinic, he convinced her that that's what she needed to do, and now she's feeling terrible about it. So educate yourself, and his site is the best one that has his information that is well researched. He has publications, he has courses you can take that helps you become more confident in being able to discuss it and talk about it. I recommend doing the titer testing and making sure that if they're already protected, they have any kind of an immunity, they can mount a response, and using that as your reason that you really don't need or want to have more vaccinations. So the older dogs, I'm sure they've had plenty throughout their younger life, and I wouldn't be vaccinating them again. It's just a window for problems. Alrighty. All right. So Lavatrice has a Corgi Beagle mixed dog, shakes when you pet him. He shakes the way dogs do after bath. Oh, okay. Well, that's not so bad. Maybe he's just getting his hair back in order. Any ideas about petting the way Dr. Edwards discussed, and if chiropractic care could help or would help? So, yeah, I guess I mean, like when they shake after a bath, it's really just to like for that, it's like blowing the water off. Maybe he feels like his fur's been mixed up a little bit and he's wanting to get it back in order. I guess it's feasible that maybe some area got stimulated depending on how rough the petting was. So, yeah, I mean, definitely chiropractic could, it would be a place to start and see if there are any subluxations that makes him more sensitive after he's been petted or handled. I don't know. Does he have any problems like if you pick him up and to move him to go someplace, or does he ever cry about that? Does he ever have a lameness? Does he sit funny? Of course, corgis kind of always have that pig sit thing going anyway, so that may not be a good thing to use as a reference point for a corgi dog. But yeah, chiropractic would be a good place to start, and it may not really be anything. All right, next question, more related to the kickoff talk. That's fine. Everyone said nutrition for a big thing, which I have always had an interest in. Is there some good courses you recommend for becoming certified? Okay, great. So actually, I do have a certification program. It's on the letter E, dash trainingfordogs.com. And in there, I have it's called Building a Better Body, and it's the canine nutrition. There's a part one and a part two, and it helps you to understand like the different nutrient factors. Well, we walk through food synergy, talk about organic versus non-organics. We go through all the genetics about how different food factors can affect the genomes and where transcriptions and translation can happen in the DNA that then affects an individual's nutrient, um, how you work through that, how the dogs do that. And then we talk about how to calculate out diets, the differences in the different diets between dry kibble and baked kibble and raw diets and lightly cooked and canned food. So I have a session. There's like, I think 9 in the part one and 14 in part two. 14 gets into more specific, like each organ or gland, what specific nutrients do they need to function optimally. But I've been doing that program for a number of years, a lot of great input on that. You can take it either just as an audit or you take the course and you don't get the certification. To get the certification, you actually send your lessons to me. I read through them, I help you walk through it, and then there's a test at the end. And they have several different programs that it's certified through. So that's been a really, really good one. And I'm sure there's now Dr. Ruth Roberts has her coaching program, which is a little bit different than my program there. It just depends on how much you want to spend and how far into it you want to go and what angle you want to take with it. So anyway, there's 2 of them for you to get started with. It'll be fun. Glad you're having fun with thinking about it. All right, Steffi says, which proteins would be able to rotate in a tropical climate? No real seasons except wet or dry. Okay. Well, I would say tropical, you would probably look at anything that's cool, neutral. And maybe I know even in a tropical climate, you do have some times where it's a little bit cool. So you could go to the warm then, or if you have a really older dog, to feed the warm is going to be beneficial. The older they are, the less capable their body furnace is, and the more difficult it is for them to give up energy for food when they need to use that energy in some other metabolic process. So on the ones that are really old, which I'd say anywhere from 12 up, potentially depending on the breed that you have, that you could use the warm foods for them any time of year. So the cools, the neutrals, and the warms, and then just probably not feeding the hots. That would be the ones to stay away from. So in the tropical, you're going to have different bird food. You could have the fish. So there'd be diets that you'd have with fish. And then, yeah, so you could do the duck, you could do the fishes, you could do the chicken, turkey, the beef, the rabbit, the pork, if you're okay with feeding that. So any of those would be ones that you could rotate through. Chelsea says, "Oh, your dog doesn't like water, so she refuses to walk." Oh, okay. So she doesn't like water at all. Doesn't want to walk in the bathtub. So that's a bummer. Um, yeah, you can still find the vet chiropractor. Well, that's too bad. There might be, they have some of these, just thinking on this, and I don't have a specific anything, but just looking at trying to think of a way. Um, some like water filled like bags that you could lay over the body, or you could put on the ground and have her stand on it. That would be, it has like water in them. You kind of fill them, but you wouldn't fill it all the way. It's a little different than having air in something. And then she could kind of stand on that, or you could maybe lay a few that she would walk on, so it would still be a little sloshy, but she wouldn't have to get totally wet. So yeah, that's a bummer when they're that way. Remember this when I was doing the underwater treadmill one time. I had this Chihuahua that had been paralyzed, and this was going to be part of the therapy. And that little stinker, she would not. She would not, no matter what. We had the harness on her. We tried the water lower. We'd raise the water to different levels, and she was just going to let herself drown. If we wouldn't have watched her, weren't in control of the situation. She's like, I am not doing this at all. I will drown rather than walk or swim in this water. So he ended up just using the cart, and she liked her food. And so he'd lay the food throughout the house, and then she'd be in her little cart that he'd made her. And then she eventually got well and was walking and running and everything. But some of them are like that. They go, no way, Jose, to the water. All right. Is hair mineral analysis sufficient to tell if a dog is getting enough calcium? Correct. Or do you also look at vitamin D and magnesium levels? Yes, the test looks at magnesium levels. Vitamin D is a different test. Like you can do that on a blood sample. So you would have to do that separately. But we definitely would do the calcium and the magnesium. And yes, parathyroid gland is a part of this. You're pretty clever here. Um, yeah. So the parathyroid works with the thyroid and the kidneys. So those three work together to regulate calcium and magnesium metabolism. And so any one of those that's skewed is going to affect the others. I do sometimes have individuals, and I do like kinesiology and the bioresonance testing. So I can actually check and see, is the parathyroid okay? Do they need the vitamin D? Is it just the calcium magnesium? But I can say that most of the time in the dogs that haven't started the TMA and had the customized nutrient balancing throughout their life, and say like they're 12, yeah, even 8 or 10, somewhere between there. Definitely by the time they're 12, all of those dogs, their parathyroid's not working so good. So standard process, if you're where you can access that company, they actually, and you can purchase it off my website, going to the shop, preferred vendors, you can click on the link and then order it up there. But they have a product called CalMate Plus. So it's calcium and magnesium. The plus in there is actually parathyroid gland. So the gland itself has factors that helps the gland work. It's like heals like. So if you have an older one, generally the CalMate Plus works really, really good to help provide the calcium, the magnesium, and help support the parathyroid. The other thing that is also that you need to help move the calcium out of the blood to the tissue is the vitamin F, which that you get out of flaxseed oil, and standard process has also Cataplex F tablets. But you can use flaxseed to help the oil to help move the calcium out of the blood to the tissue. So that could be another reason why the parathyroid. And then vitamin D, replace the vitamin D. Most of the times they'll test best the micellized. The one I use for measuring is 30 micrograms of the micellized drops. And usually a dog that's like, say, 20-pound dog would take like 1 or 2 of those drops, like 2 drops once or twice a day, and then more as they get larger. But it all works together. You're totally right on this. So the test will tell, is the calcium and magnesium levels adequate? Or do we need to affect those? And then I'll evaluate by the age. And then the vitamin D would actually come from a blood test if you weren't doing muscle testing and could tell if the vitamin D was needed. All righty, good question. I like that. Brenda says, any recommendations for shrinking and or eliminating an epulis in the mouth? Oh, those are, yeah, boxers tend to get a lot of those. Some other breeds can too. Um, so you're thinking about wanting to have a way of eliminating it is doing surgery. I like to do cautery where it actually cuts it off. Sometimes they will come back in another area. So it's still in the mouth, maybe there or maybe somewhere else. And like I said, it's a little bit of a breed thing where they tend to get that excess tissue. You can try putting some frankincense oil mixed with like vegetable or coconut oil and rubbing that on the area to see if that would make a difference. There's also bloodroot. And bloodroot, well, that's a plant. It's a flower that grows at the edge of woods. It kind of has a daisy-like flower on it, but the root of the plant, instead of being a green-gray color, is like a brownish blood color. But it has a propensity to go after rapidly proliferating cells. So it comes in a salve, it comes in an oral form, and it comes, so that's from Buck Mountain Botanicals. It's called Sun Salve. And then I also have a homeopathic company that also does herbals. So I have another herbal blend of that bloodroot. And so you can give that orally, or you could take the salve and just apply it topically, and then that would dissolve it too. So both of those could help with those. They're just very, very firm, nodular-like, and they're right at the edge of the tooth, and they can get big enough that then they let calculus accumulate on the teeth or food particles get under there. So they can be a problem. Some of them will have just one, other ones will have a mouthful. All righty. All right. So Rachel's saying that omega-3 fatty acids are anti-inflammatory. Sure. Yeah, they are. Yeah, it's about having the right balance of all of those. She then said that we'd prefer to have lower omega-3s and higher omega-6s, wouldn't be the other way around. Um, so it's an interesting thing, and everybody's an individual. If there is a lot of inflammation going on in the body, which I do by the hair tissue mineral analysis test, there are like, so I'd have a really high sodium in that individual. Those are the individuals that giving the fats is good, but they can be deficient in different areas. So the omega-6 fatty acid, like what's in black currant seed oil, that's the one that is needed when the dog has that old crusty nose where the nares just are thick and they have layers of these little like scales. That's an omega-6 fatty acid deficiency. So we're going to go to the sixes. That individual needs more of those. And then the omega-3s, so you can have the EPAs and the DHAs, and there's a balance with those, and a lot of different ways that you can provide those balances through different, like ultra oil, Nordic Naturals, those are both liquids. There are a lot of different companies out there. The smaller fish, I like to actually utilize those rather than a lot of the larger fish, unless the company is really testing for the heavy metals and things like that. So I don't want to overstep on what Dr. Bessett was saying on her presentation. I mean, certainly your point is well taken that you want to avoid too much inflammation. You don't want to have a lot of the pro-inflammatory things in the body, which is why, eating a lot of French fries and things like that for us is not good because it's going to throw it in that direction. But it does make sense from that perspective that you would want more threes and less sixes, but not everybody is the same. So there are times when you need something to help offset. And then also from that other perspective, there are some individuals, and this could happen a lot of times as they get, sometimes you need that pro-inflammatory response to get healing started. So a body that's not healing well, that's kind of stuck in a state, can oftentimes be because the body needs that rhubarb, that redness. The inflammation is part of the healing process because that. Okay. So, yeah, you have to have the setup of the inflammation first. That's why if you have a wound, it'll get red around there. Well, that's the body calling in all the healing mechanisms. You have to have some of that in order for healing to occur. So it may be that that was the reference that she was talking about that in regards to that scenario, that in an individual where healing processes are not happening like they should, you need some of that inflammatory cascade to start the healing process. So in that situation, you would want the sixes there because the body doesn't have any and they're not setting up that healing cascade. So that's why you have a red area. And to take away all that redness sometimes actually slows down healing. While it can feel good because you're not hurting right there, it didn't do any benefit to the healing process. Sometimes you got to let some of that redness and that swelling happen in order for all the right healing mechanisms, even the cells that come in to clean up the debris, they're called in. And some of that is done by those pro-inflammatory products, mediators in the body. All right. So she said her Pomeranian Chihuahua has really itchy skin, tried several different things to help rid his itchy skin. Okay. So just from that perspective, I can say that if he has a high aluminum, that in itself can create a lot of allergy problems and itchiness that you can try to treat. But unless if the aluminum is still high and that's not been addressed, you're not going to get total resolution. So that is something that you might want to look at. Any tips that would help, or any bland diets that would help get rid of itchy skin or inflammation? Well, from that perspective, I mean, I'm guessing you've probably changed the food. The protein that most dogs tend to be allergic to is chicken, and that's because it's the protein that in the early years of their life, if you didn't start them on a raw food as a baby and they were fed any kind of kibble, majority of the kibbles are going to have high grain content, and then they have the poultry in there, they have the chicken, and then the grains mess with it over time, having a lot of it in a much higher percentage than what is their archetype diet. It alters the liver's digestive process. It alters the channels in the intestines, and then what happens is the protein gets inside the body as a protein instead of already being an amino acid, and that's when that allergy reaction starts setting up. So I'm guessing you've probably already taken them off of the chicken just to make sure it's not that, and maybe try a protein that's not a poultry at all, because sometimes one poultry goes to another poultry. I've had some dogs that they could have nothing that flew or swam, but it got to start somewhere. Okay, so that would be one thing, improving that. I'm not necessarily saying it has to be bland. Um, Bland would be like two ingredients void of many vegetables. You're usually not going to have an allergy to vegetables per se, so you could try things that could help there. Itchy skin, you can use neem to help cut down. Nettles can help cut down itching. That's where a like heals like, because nettles, if you ever get into them out in the field, it's very, very itchy. But you can take that like as a product or a homeopath, and it will work the opposite direction. Making sure that the liver, anything that's an allergy related is a liver problem. So doing some dandelion root can help the liver. Certainly the got a mental block, but liver products. So look for some kind of herb blend that's labeled for helping liver. The dandelion helps some. There's other ones out there that can help with the liver too. So looking at some of those burdocks and things like that may help as well. The nettles, the neem can help with the itching. Topically, I like aloe vera. If you live where there's the aloe vera plant, just cut one of those leaves off, cut it open. You can go online and find out how to harvest it, but it's pretty easy. Just take a spoon and clean it out of there. I put it in the refrigerator because it's cool then, and you can dilute it and then rub that on the body. But you can also get topical sprays that have aloe vera, maybe lidocaine if they've got some really itchy areas that are like a small, you don't want to do the whole body in it. That's my point. But if there's a certain area where it's a little bit bad, then you could apply the lidocaine to help stop in the itch. And if it's really bad, like hot spots, you can use a little bit of cortisone. Got a hair in my eye. Alrighty. All of those can be helpful for the itchy skin. Underlying is getting at the liver. We tried that apple cider vinegar with mother and water, but it didn't stop the yeast. Well, maybe the yeast is secondary and not the original problem anyway. The other thing is interesting too is that the apple cider vinegar with the mother, that one, when you take that orally, it actually becomes alkaline. And so we usually see the yeast, really yeasty dogs in a situation where they're parasympathetic dominant, so they already tend to be a little bit more alkaline. You have to do the regular white vinegar. That one, when you drink it or you take it in orally, it stays as an acid. But the apple cider vinegar actually switched to an alkaline pH in the body. So I got this whole little book about pH, and sometime I'm going to put some programs together about how to navigate the pH because that makes a big difference on minerals and keeping them in solution, the calcium, the magnesium, and all that with the pH. And the autonomic nervous system, one gets geared up and how you can try to balance that. Alrighty, well, and then lots of baths, different kinds of shampoos can help with the itchiness too. Also, I recommend too checking, you may have already done this, but laundry detergent. If you have certain kinds of laundry detergents you've been using, especially if there's any perfumes in them, trying to, and then it's a small dog that's on your furniture or on your sheets and things like that. Even just you holding them on your clothes, if they have a sensitivity to that, would be to bathe them more often, just keep the pollen and dander off of them, dust and things that float and land on them. So you could bathe them weekly and then using, I like Tropiclean. They've got a lot of really good products if you're in an area where you can access Tropiclean. But yeah, keeping all those evils off from topically. All right, so you're welcome for the meloxicam alternatives. Speak more about titer levels for an older dog. Okay, still very active. So a titer is a test that's done by drawing a blood sample and it's sent off to a laboratory. Or nowadays, the distemper parvo kinds of tests can be done in clinic with like an ELISA. It's one just like we used to do with the heartworm tests and that where you drop the, you may have to spin it, it may be serum, maybe a drop of blood goes into a little chamber and you snap it, like doing the coronavirus tests and all that. So that what it's going to look for is the presence of antibodies against that virus. So antibodies against the distemper virus, antibodies against the parvovirus, antibodies against coronavirus. And if antibodies are present at all, then your animal is protected. Now the labs do have some where they'll say, you know, like you want it to be at this level. It's kind of an arbitrary thing. And if you go to vitalanimal.com and go on to some of the courses and the information there, there's a lot that's been published about the fact that if there's, the body doesn't continually mount antibodies, antibodies, antibodies. That would be a waste of good energy. There's other things to be addressing. So if there's any antibodies at all, that just says that if that individual was exposed to the virus, all of a sudden they could shut down another factory, open this factory up, and start making more antibodies to help fight against that virus. So to say that they need a titer of a 1 to 32 or a 1 to 64, kind of an arbitrary number, but definitely read about it and get that for yourself so that you know that you understand it well. So any kind of titer is valid. As far as rabies goes, in the United States, all rabies titers go to Kansas State University, and that's where that test is run. Same kind of thing, it's looking for antibodies against the rabies virus. So it's a different pricing schedule. There are no in-clinic rabies titer tests that can be done. They're all shipped out to a laboratory. Not as inexpensive as the others are. It can be a little bit more expensive, but you have several alternatives for that. There's some options. Dodds does a rabies testing program. There's another, and I don't remember his name right now, practitioner, scientist that has a site for doing rabies testing. Obviously, it would go through him, but still goes to K-State. Okay, so I don't know exactly where I cut out on that one. The rabies titers, I'll go to K-State. There's Gene Dodds. There's another practitioner, and then our clinic. You'd have to Google up rabies titer testing dogs and see what kind of options you get. And some clinics will do it. Others will do it, but they try to talk you out of it. Other ones don't do it at all. All they do is vaccinate. So you have to find the right doctor that works with you, that is understanding about the consequences and the problems that arise because of the hypervaccinosis. So hopefully that helped explain titers a little bit more to you. And then what I always did too after the titer testing, I issued a certificate of immunity so that you could go to the groomers or go to the dog park or wherever, and it says that this individual has been vaccinated properly and was titer tested for immunity and chose protection. So not going to give it or get it. And so that's a little extra thing there. Okay, so Patty is a senior, single woman on limited budget. What are the most important tests to get? Well, I guess it depends on what you want to do. Should I do these tests you refer to rather than the traditional blood tests at the vet? Okay. And then says, what is vital? Oh, not vitalanimal.com, but you're saying what is necessary. Well, everybody's going to have their own opinion on that. And you're asking me, I don't know how old your senior dog is. The blood test is going to tell you right then, there, that moment, is there a destruction or a disease process that's escalated to where the body's breaking down? That's what the blood test is going to show you. And if your animal is struggling, then that's certainly where you want to start. The hair tissue mineral analysis, this test is going to give us indicators of things that are brewing, something that's happening under the scene that is potentially going to become devastating. It just hasn't reached that point yet. So if you want to be more proactive and prevent large veterinary bills in the future, then to start with the hair tissue mineral analysis test, get that run, and then start doing the things that it recommends. So the least expensive for you to get that done would be to go to checkpup.com. checkpup.com, checkpup.com. That's the site that is like my brain in a computer that puts out the information, the data based on how I operate thousands and thousands of tests. So it gives you guidance on feeding. It'll let you know to what degree the toxic metals are a concern, and it goes through the minerals. It will give you suggestions on what you need to do in different body zones that may be starting to show a problem. So that would be the least expensive of the tests to do the hair tissue mineral analysis. Yeah, so that's the way I would operate. Is if there's not active disease, then let's be proactive towards prevention. And if there is seriousness, then get the blood tests and then try to figure out how did this go wrong to begin with, which still brings you back to the hair test. All righty. All righty. What are recommended supplements for a senior dog that has developed a clear runny nose? Okay, well, I'm just going to stop with that part first. A clear runny nose can be a good thing. So a dry nose is an indicator that that individual is on sympathetic dominance. Sympathetic system, when it turns on, all of the tears will dry, the mouth is dry, the nose is dry. That's sympathetic dominant. It's the fight or flight system. In order to have a wet nose, moist nose, tears at all, you have to be parasympathetic. That's when that's produced. The saliva is produced when you're digesting, and that's the parasympathetic system. There's an enteric division, which is part of that too. But if we just look at those two, there's three divisions of the autonomic nervous system. But if we just look at the turn on and turn off, so that's not necessarily a bad sign. Now, maybe your dog has become more parasympathetic, which is also not unusual because everybody, as you get older, if you live long enough, your thyroid's going to be weak, the hypothalamus, the pituitary, the whole endocrine system, like everything wears down and it doesn't have the same get up and go it did. So it could be that your dog has hit that point where it's becoming more parasympathetic dominant. And you say probably an environmental or seasonal allergy. I don't know about that. I mean, you could have an environmental seasonal allergy, but people get sinus problems. With dogs, it's more itchy skin, not so much the sinus thing. I would be leaning towards my first explanation is about why it is. No sneezing or coughing, so that's good, not infectious, not a foreign body or anything. That is luxating patellas. Well, that goes along with some breeds. And I don't mind them luxating as long as it doesn't get stuck when it's going back and forth. So the kneecap, the patella, sits in the groove there at the distal femur, and it's supposed to slide and stay in this groove. But sometimes the ridges on the outside of that groove, they're either not tall enough to begin with, or with age they wear down. Especially if the dog's a little bow-legged, it keeps wanting to the kneecap doesn't go around the bend, it goes straight, and so it starts to wear. It's like water going over the rocks in the creek or the river. It becomes smoother and smoother, and so it hurts when the ridges are high enough and that kneecap has to pop over them. But as those ridges get smoother and lower, that little kneecap can move around. It doesn't bother the dog at all. It's not painful. And I would never do surgery on one like that because he's not in pain. You go in and try to make that groove and recreate that dog's going to have arthritis in less than 2 years, and it'll be bad and it'll never go away. So not necessarily something to be overly concerned about. It just can be breed anatomy. Keeping them adjusted chiropractically, at least earlier on, definitely can make a difference, and a lot of times correct those knees, and that tendency to deviate like that can go away. So if the pelvis is shifted, like a pelvis that's high is going to tend to pull that kneecap up and allow it then to not land in that groove. So chiropractic adjustments would also be recommended for this one. Gut issue. Now, I would say becoming more parasympathetic dominant, the gut issue should start to go away. But that also depends on, does the gut problem start with the parotid gland in the mouth? Is it in the stomach? Is it the liver, the pancreas, the small intestines, the colon? Where is the gut problem really? And sometimes where you think it is not the real source of it. So correcting the gut issue, we can do a lot of that with the hair tissue mineral analysis test too, because we find out more about all the areas of digestion and how to approach them correctly. But you got a lot of things going on there, a whole lot you can work with. All right. If a dog does have high aluminum, how do you get rid of it? All right. So the first thing with any toxic metal are toxins or toxic chemicals that have gotten in the body. And number one is to replace the deficient minerals and vitamins, nutrients. So from the rest of that report, we would know what do we need to do to help correct the body. Because in real life, that the body won't keep toxic metals and things on board if it can move them out. So if the organs of elimination are not working properly, or the body does not have in that interstitial fluid enough of the nutrients that it can utilize to run metabolic processes that it needs to do at that cellular level, tissue level, then is when it can. And aluminum is a very soft metal, and it's everywhere. It's a very common one that it can kind of become a surrogate, and it can fit into a space that some other nutrient is really supposed to be there. So I always liken this to putting in a high performance car regular unleaded gas. So like a teenager that wants to go to the city, lives in the country, wants to get to the city. He's got this old high performance car that he got from his grandpa, but he doesn't have the money to put that fuel in, so he just puts in regular gas, gets him to the city, but the engine's going to knock and pee. You do it once, okay, that's not so bad. Okay, so if the person with the car example does that regular fuel in a high performance car, it'll knock and ping, and the engine, if you continue to do it, is not going to last as long. And that's what happens when these toxic metals are still there. So it's very, very rare, unless it's like a 2-year-old dog, somebody super young who's already healthy, and they have a really high aluminum, which probably came from the mother. In those situations, sometimes we can go ahead and start the detox program earlier on. And there are a lot of different things we can use for the aluminum to detox it out. But number one, in like 99% of the cases, is to replace what's been missing, and the body will begin to gradually precipitate out those toxic metals, and then they don't cause such a negative effect on the body, because you wouldn't want to take one that's already allergic, has a liver issue, not address the liver, try to detox them, then more of it ends up in the blood, and they're just going to be worse. So got to take the right steps. So number one is replacing deficient nutrients. What is a good natural remedy for hyperkeratosis on a dog's paws? Alrighty. So I would look, number one would be vitamin A, probably zinc. Zinc, vitamin A, vitamin E. Those are going to be the three things I'm going to be looking at that could be deficient in that body that's caused that to happen. So you can get zinc oxide for one, which is a topical that you can apply, which is not super expensive. That you apply it topically. You can get vitamin E and lanolin in like topicals that you could mix with the zinc oxide and apply that on topically. So what it is, oh, and vitamin A. So you would then give vitamin A or feed the vegetables and things that have a lot of vitamin A, like carrots and things like that. But you can get vitamin A, standard process as a cataplex A. So you could do that. So you could get the vitamin A, give it orally, give zinc orally for sure. Both of those orally. You can do vitamin E orally. You could do them all orally. But those are the three things I'd be looking at first. Maybe considering biotin somewhat too because of that. All righty, so we've got our last question coming up. We've just got a minute or so. 13-year-old staghound greyhound with arthritis, taking him out for sharps walks. Yeah, they do enjoy that. Knuckles over in the back feet. No, you don't stop activity. What I would start with to help them, so sometimes as they get older, the perception of their feet, so the nerves going on, this is a really good question. Thank you. I like this. Goes all the way to those feet, and the feet are a little bit numb. So what I would do is, if you have long hair and a ponytail, or you can get some of those scrunchie things, and you just put it up above the hock. So the ankle area, the back foot, you put one of those, not so tight that it cuts the circulation off, but just put it up over there, and then they feel that. They don't like wearing them booty things so much. That'll make them pick them up, but it's so harassing unless they've been wearing them since they were a youngster. But you can put that scrunchy thing up above the hock, and then he'll feel that and pick it up. I didn't see what the rest of the question was, but that may be the end of our questions for the day. And you'll have to come back tomorrow and then put the rest of it back up there. Thank you, everybody, for being with us today. I'm looking forward to tomorrow. We've got another program, a great one tomorrow. It's hands-on help and exercise. So some of the things that you were asking questions about, there's going to be more of that in tomorrow's program. I'm going to do the harness fitting, which is a whole lot of fun. Dr. Barbara is doing the kinesio and Reiki. That is way cool. The kinesio tape. That's another thing that could help your dog too with picking up the feet. Bobby Lyons is going to go through some. She was really big about Fit Paws. She's like a pro with the whole Fit Paws program. And so she's going to share some things with that. Dr. Lang is going to go through some massage and exercise for the seniors. And then Lauria Chu, she is so funny. She's going to show us some novel ways to help with the seniors and doing some massage and exercise and stretching for the oldie ones. So thank you all for being with me today, for continuing on in our Senior Dog Care Summit 2.0. So give your pooches at home a big hug. And for me, from Dr. Ava, give them a kiss on the noggin. See you tomorrow.